Welcome back. Surgery and chemotherapy may extend the lifespan of a cancer patient and in some cases possibly even completely rid the patient of disease. But those treatments also come at a cost. Massive amounts of chemicals can put tremendous wear and tear on your body. There are many choices to make in life, especially when confronted with a decision on how to handle your health issue. It can mean the difference between quality of life and suffering. At least that's how I felt when I was confronted with my life or death diagnosis. I chose quality of life, and that included Dr. Gonzalez, the author of several books on enzyme therapy, as well as What Went Wrong, the truth behind the clinical trial and treatment of cancer. Never heard of it? Well, let's enlighten you. Good morning, Dr. Gonzalez. How are you?
I'm fine, Carol. Thanks for having me on your show.
I know so much about your therapy because, as I just confessed to all of America, I am your patient, and you saved my life. I really credit you with that. Your therapy is based on real scientific knowledge that extends back to the 1920s to Dr. Beard. Isn't that true?
That's correct. What we do has a 100-year history. Dr. Beard wrote his first paper in 1902 suggesting that pancreatic enzymes have an anti-cancer effect. He wrote a wonderful book in 1911 that should have changed the course of medicine and unfortunately did not. He should have changed the course of cancer research, showing that a simple natural element, pancreatic enzymes, have an anti-cancer effect.
You found this course of therapy. You were studying to be an MD, which you are. You had a great mentor at the Sloan Kettering, and you found Dr. Kelley, who was actually a dentist.
Kelley had rediscovered Dr. Beard's work during the 1960s when he himself was confronted with cancer, and he got well. He'd been an orthodontist, but his practice quickly changed to treating patients with advanced cancer for whom there was no other treatment. And back in the 1960s, there weren't a lot of treatments for advanced cancer, and he had great success, and all the local doctors would start sending their cancer patients to this dentist, and that's how it all started.
Well, it actually started, he was trying to take care of his own health issues, correct?
Yes, he had been diagnosed with pancreatic cancer and was told he had 6 weeks, 8 weeks to live. Just fortuitously rediscovered Dr. Beard's work, started treating himself with pancreatic enzymes and an organic diet and other things, and got well. He didn't die. So he was in a small town in Texas, and everyone heard about it, and the doctors began sending them their patients to be treated by this dentist who was reversing cancer with enzymes.
When I chose to come with you, one of the things, the hurdle that I had to get over was the fear of following an alternate therapy. Do you come across that a lot in your practice?
Every day with every patient. When patients choose an alternative therapy, they're going against often their family, certainly their doctors, who think alternative therapy is a waste of time at best. And they really have to make their own decision, stand on their own 2 feet, and decide that this is what they're going to do, regardless of what anyone else says. So you're kind of alone. You know, when you go to Sloan Kettering to be treated by with cancer, no one criticizes that. You're going to Mecca. Everyone's on board. The friends, the family, the neighbor, the postman, the health food store owner, all of them are happy you're going to Sloan Kettering. When you choose an alternative therapy to treat cancer, everyone gets nervous. Are you sure this is the right thing to do? The postman, the mailman, everybody has an idea you should be going to Sloan Kettering.
And I've lived through that myself, but I feel it takes, you know, when they say it takes a village to raise a child, it takes a village to make you healthy, because I had the support of my boyfriend, my family, my sisters, even my sister who's a nurse. Everybody supported this, so it was very easy for me to do it. And sometimes my boyfriend even dabbled with me to keep me feeling like I was on the right path. And in fact, he insisted I do this, so it was very important for me in my therapy to have people who believed in it. But of course, on the street, I come across a lot of people who are, you know, they're nervous about it. They don't understand it so much. Explain a little bit about how the enzymes work. Maybe we can clear that up.
Well, pancreatic enzymes were first discovered around 1858, and they were known as digestive enzymes. These are the enzymes the pancreas produces to help us digest our food.
So we have it anyway. Everybody has it.
Everybody has them.
But maybe not enough?
Maybe not enough. Now, Dr. Beard said in addition to their digestive capability, they represent the body's main defense against cancer and would be useful as a cancer treatment. And he showed this both in animal studies from 100 years ago as well as clinical work with patients reversing advanced cancer 100 years ago. We ourselves have been able to finance laboratory studies with animals showing they have a very powerful anti-cancer effect. We haven't had the finances to do the elaborate molecular biology studies to confirm exactly how they kill cancer cells. We suspect they attack the proteins on the membranes of cancer cells, which are different than the proteins on normal cells. And the pancreatic enzymes selectively attack these proteins. And when these proteins on the membranes of cancer cells are destroyed, the cells die. So we think it's that simple.
So maybe all we really need to know is that it attacks these cancer cells and doesn't allow them to get a foothold in the body, and that is really important in terms of keeping your body safe and healthy.
That's correct. They seem to just kill them, digest them like a piece of meat, whereas they don't affect normal tissues. So from our perspective, it's a very useful, we think, potentially ideal therapy because it doesn't have a negative effect on the standard normal tissues.
So basically, because your therapy involves a lot of supplements, people have to be able to eat. But if you're advanced at a point of cancer where you can't eat anymore, you really can't do this type of therapy. Is that correct?
We're very realistic about what we can and can't do. We can't treat a patient if they can't eat. All our therapy is oral in nature. Patients have to follow a diet. They have to take the supplements orally. Now, with industry support, we could develop injectable enzymes, but they're not currently available.
All right, so I actually brought my pills. Here you go, Doc. This is how I actually do my own pills. That's lunch. And this is breakfast and dinner. And this, so these are my boxes of pills. So it's not hard, because once you get a whole system down, it's not very pretty, but it's not hard. Once you get a whole system down, I just do it. I don't even think about it. I know a lot of people complain about it, but the truth of the matter is I just do it. And once you get the results that you get in your therapy, you're pleased to do it. I'm proud. I hold up my pills at every dinner. I'm like, here I go, 27 pills all at once, you know.
Well, as you know, I follow the program myself, and I have my own pills in my pocket. I never had cancer, but I do it for prevention, and I guarantee if I were not on my program, working 14-hour days, 6 and 7 days a week, I'd have been dead 15 years ago. So I credit my own therapy for keeping me going in good strength and feeling healthy 99% of the time. So it really makes a difference.
Well, doctor, I think that you have made a huge difference in my life. You saved my life. I thank you for that. And I hope that this information helps a lot of people out there. Thank you so much, Dr. Gonzalez.